Hello everyone and welcome to today's webinar, Preventing Falls Part 2. Your presenter is Andrea Salmon and my name is Annie Sasson and I'm your facilitator. We begin all our programs with an acknowledgement. We acknowledge and pay respect to the traditional custodians past and present on whose lands we meet today. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we respect the cultural authority of the elders in each community. Okay, I'd now like to introduce you to our presenter. And our presenter today is Andrea Salmon. And Andrea is one of the Education and Wellbeing Program Coordinators here at MS. She started her role at MS as an occupational therapist and has held various roles since that time. Andrea believes that knowledge is power and wants people living with multiple sclerosis to feel supported and empowered to make informed choices regarding living well with multiple sclerosis. In her current position, Andrea is able to combine clinical experience and her educational philosophy to provide quality experiences for people living with MS, their friends and family, through our webinars and our face-to-face wellness programs, which we hope will be coming to you in the new year. And as I notice, we've got Andrea's put on her webcam, so welcome Andrea. Thanks for presenting this webinar for us today.
No worries. Thanks, Annie. Thanks for introducing it so nicely. This webinar really is a part 2, as Annie said, following up from part 1 of Preventing Falls, where Dr. Fu Huang, our physiotherapist, part of the MS team based at Lidcombe, stepped us through the research that actually showed us that falls are a huge problem for people with MS. He also talked about the characteristics of who is likely to fall, and then Fu gave us some recommendations of ways to prevent falls from a mobility perspective. But then we realised there are actually some other ways and some other things that we need to think about that can also help us to prevent falls. And perhaps these are a bit more practical. So part 2 is going to look at these, as well as how to get back up after having a fall, if that happens. So that's why we've got a part 1 and a part 2. So in part 1, first showed us that there's evidence that 60% of people living with multiple sclerosis are likely to have a fall within the next 3 months. Those falls will mainly take place during the daytime, and they'll mainly take place at home. So we're actually thinking that perhaps we can all work together to reduce that statistic. So again, in part 1, Fu showed us that the most likely people to have a fall are people who have some impairment to their balance, or maybe some impairment to their mobility. So that could be spasticity in their leg muscles, or maybe an ankle joint contracture. Maybe they're people who are using walking frames or walking aids in some form. Another characteristic of people that might have a fall are people who have changes to their cognition, and we'll get onto that in a little bit. Also, people who might be experiencing some level of muscle weakness in their lower limbs, or maybe people who are experiencing fatigue. And then there's people who maybe fall into the category of being a bit fearful of falling, or maybe their cognitive change is just around a bit of forgetfulness, you know, nothing particularly dramatic, but just that little change that means we're perhaps not paying attention quite so well. Or maybe there's people who are experiencing incontinence and might have to rush to the toilet. So there are a whole lot of reasons and a whole lot of then things we need to think about to try and prevent those falls. So again, in part 1, we looked at the ways to improve balance, to improve mobility, and to strengthen our leg muscles. In part 2, we're going to look at some of the additional practical strategies to reduce the risk of falling. So the things we're going to look at are that we need to reduce our risk factors. We perhaps need to slow down. There's an aspect of our vision that plays a part. Then there's the really practical thing about the shoes that we're wearing. We want you to consider your environment, and then we'll have a word on medications as well. So the first one is to reduce your risk factors. Now, if you have any changes to your leg strength, your balance, or maybe some foot drop, you really need to reduce the clutter around your home that can contribute to your risk of falls. Things like rugs on the floor, bedding that beautifully drapes down onto the floor, or even throw rugs. They're so much part of our decor to have a throw rug, but if they're draping on the floor, they can dramatically increase your risk of falling, as can things like cords. And I've got to say, I've got one right beside me today that's trailing across the floor to a little table. Shouldn't have it there, because if I got up quickly to walk away from here, I would be very likely to fall over that cord. So that idea of general clutter can increase your risk of having a fall or tripping. As to can rushing. So if you're rushing to get somewhere, that can also be a reason why you'll be more likely to topple over or miss seeing something that's in your way, or have that experience of dizziness that comes from getting up too quickly, or simply tangled in your own feet. So if this is a timing thing, as someone living with multiple sclerosis, you need to be more conscious of giving yourself more time between appointments or more time between tasks, and to really pace yourself in the things that you're doing that require mobility and walking around. If you get a sense that this might relate to rushing to the toilet, and I mentioned this a little bit earlier, perhaps it's time to see a continence nurse for some advice. Having to rush to the toilet is a surefire way of increasing your chances of falling over. So have a think about if maybe that might apply to you, whether it's just the timing thing or the bathroom thing. Why are you rushing? What needs to change in regard to how much you're rushing for things? And then there's the observation or the awareness we need to have of our vision. If your eyesight has changed, or if you experienced blurred or double vision, even if that's a temporary phenomenon that might be related to your heat intolerance, this is going to significantly add to your risk of falling over. Equally, if you've recently had your vision corrected or you've got new glasses, remember to allow for a period of adjustment and take extra precautions during this time. I strongly remember the time when I first got my multifocal glasses, great for reading and great for distance, but oh my goodness, the first time I did steps with the multifocals, just that, I had to take that element of slow down, use the handrail and get down safely. And if maybe you haven't had your eyes checked for a while, perhaps it's time to get your vision checked again and talk to your neurologist if you're noticing that blurred or double vision is a more frequent phenomenon for you. Then there's that comment about shoes. Choosing the right shoes for the right occasions will also help you prevent the risk of falls. And most importantly, if you have any balance changes or that foot drop that a lot of people experience, even while you're getting treatment and advice, make sure you wear shoes that don't add to your risk of having a fall. You can always have your dressy shoes in your bag, and when you get where you're going, swap them over. But for the walking, make sure your shoes are sensible and safe. That's the way to go, absolutely. And we need to think about our broader environment. Now, clutter is one thing, but there are other aspects of your environment which can add to your chances of falling. Do you need to have better pathways in your garden? An unmade path is a greater falls risk than a paved path, so long as the joins are even. Are there pavements in your area that the council need to repair? Give them a call. Get it happening. They don't know until someone calls them and tells them something's uneven. Do you need to think about the lighting, whether it's around your home or in your workplace? Is there enough light to ensure that you can complete the task safely? Do you need a low level light at night time for when you get up, maybe to the bathroom overnight? Even the temperature. If heat makes your balance worse, or that blurred vision that we were thinking about before, you perhaps need to put in more thought in planning around the heat that you might be experiencing and not doing activities when you're hot that will make you more likely to fall. There might be other things that you can identify in your environment that could be adding or contributing to your risk of falls. Maybe there's something that's come to mind now that you can change and make it better for yourself. And we say this a lot, but you need to have a think about the impact that the medications that you're on might be having on your balance, on your judgment, even on your fatigue levels that could be contributing to your risk of having a fall. And if you're worried or fearful of having a fall, it's a worthwhile conversation to have with your pharmacist or your GP to work out if there are any medications that you're on that could be contributing to your falls risk. There could be a better alternative. So this is the chance now to have a think about the things we've been talking about and to run a poll. Thanks, Annie.
No problem. Okay, let's have a look. I'll launch that now. And the question is, have you been prompted to follow up any of these other factors for falls? And the possible responses: yes, I need to declutter. Yes, I find I rush a lot. Yes, my vision might be contributing. Yes, I need more stable footwear. Or unsure if any of these apply to me. And please feel free to type in your response into the questions pane. If the responses that are listed on the screen don't apply to you, we'll still love to hear what your comments are, so please type it into the questions pane. All right, I can see most of you have responded, so that's wonderful. Just give it a couple more minutes. All right, I'll close that and let's share the responses. All right, there you go. So 25% will declutter, so that's great. 38% find that they rush around a lot. 6% say their vision might be contributing, and another 6% say their footwear might be a contributing factor. And 25% say they're unsure if these apply to them, so that's fine too. And I noticed that Anne has written in to say that 3 of these are applicable to her, so you might find more than one. All right, thanks for participating in that poll.
Thanks, Annie. Absolutely. Look, that's fabulous. It's fabulous that it can be sometimes such simple things that we know, or it's only when we're highlighted that we can see that it contributes. I know I've got one particular pair of shoes that it doesn't matter where I wear them, whether it's, you know, just in or it's flat. For some reason, I always go over on my ankle in these shoes. So it's obviously something about the heel, and they're not particularly high. So it's kind of like, oh, get rid of them. I shouldn't be putting myself in that position of risk, so they should go. So thank you for contributing. It's good to identify things that might help prevent having a fall. So we thought it was also important to have a little chat about what happens if you do fall, because, you know, in risk of having a fall, you've got to know how to get back up. So first, check to make sure that you don't think anything, and if you've got a program that some people wear for their security, that's time to use it. There's also some guidance in this short video And I'll share that with you now.
I'm going to show you how to get down to the floor and back up again safely. In the event of a fall, this may be helpful. You need to familiarise yourself with movement towards the floor. You can build this up slowly. When you feel comfortable to do so, you can make your way towards the floor and down. Should you have a fall, you need to place yourself on your back and compose yourself. When you feel ready, bend one knee, then the other, and gently roll yourself to your side. Press yourself up to a seated position and either drag yourself or come up onto your hands and knees and make your way to a stable piece of furniture. Steady yourself and rise slowly. And then sit down. And tell your doctor you've had a fall.
So hopefully that's helpful. She's very earnest in her video, but it's a good reminder to of how to respond after you've had a fall, if you have one. But let's try to prevent them, hey? So, short and sharp, this program today. Let's head to our summary. So while we absolutely know the huge benefits of exercising to make sure that we're staying strong and improving our balance and reducing our spasticity, there are also some other practical things you can do to reduce your risk of falls that we've found today. So we want to make sure you're exercising as much and as often as you can, but we also want to reduce our risk factors. So we're going to declutter and slow down. We're going to consider our vision and choose good shoes. We're going to think about our environment, and we're going to rethink our medications. So 20 minutes on and we've reached the end. Annie, are there any questions or comments that people have made along the way?
Yes, there are, Andrea. So I'll just go through them now. Elizabeth has mentioned that she needs to be mindful of how she's walking and be wary of not being distracted, because that's when she's prone to fall due to her drop foot. So that was a good point to make.
That's a great one, Elizabeth. I actually remember when my dear mum had a stroke, that was the key information that the team were giving her, to not try and multitask. So just to concentrate on walking because of all the distractions that can add. That's great, Elizabeth. I think I'm going to add that to the slides next time. Thank you.
All right, that's cool. And Gail has written in to say that she's been falling even before she knew that she had MS. And now that she knows that there's a large lesion on her brain, which is affecting her balance and her falls. And she's also mentioned she had a fall last night. And she says that she tries very hard to be more careful, but this doesn't always happen. Decluttering will be helpful, but she does fall a lot and often to the ground as well. So that makes it difficult.
Yeah. Well, hopefully, yeah, that idea of decluttering and then knowing what to do if you've had a fall to get back up, but also remembering to get the underlying causes looked at so that you can improve your balance even with a lesion that's impacting. You can become involved in an exercise program to improve your balance. So be encouraged. Be encouraged.
Yes, absolutely. Anne has said that she finds that her street footpath is very unlevel and she very nearly trips often. So got to be very mindful and attentive to that.
Yep, absolutely. And sometimes, believe it or not, it could be safer to walk on the road if the road is flatter than the path, or around our area, a lot of paths are not made. So there is no path in our street. So it is much better to walk on the road. Yeah.
Yeah. Anne's also mentioned that she'd like to know a bit more about drop foot. So if you can describe what that is, please, Andrea.
Yeah, okay. Now, I think there can be a number of causes, so I'm not going to pretend to be the expert on why it happens. But for some people, the normal walking movement is that our toe lifts as we walk. So, you know, kind of have this toe up movement. But for some people, there can be various reasons, whether it's weakness in the muscles of our lower leg, that can mean when you lift your knee, so you've bent your knee, you have less ability to bring your foot up. And so there's a weakness there that means your foot stays down. I can't, it's hard to show you when I'm doing it with my foot. Can you tell that down under the table?
Yeah, we can tell.
But that can cause you to trip, because our brain is thinking that we've got that foot raising happening, but if it's not happening, the toe of our shoe can catch on the pavement or the carpet, and that can cause us to stumble. So people can get that treated in a number of ways. Some people have a AFO, ankle foot orthosis, that fits inside their shoe, that holds their foot in the correct angle for good walking. Other people have strapping that they use to help support that foot drop. And even there's an electrical stimulation device that you can have that activates those muscles to get that foot raising and having the clearance. So it's worth getting checked out to see if you've got that, because there's some good solutions. I hope that's kind of been clear. The physios listening will be mortified with my explanation.
It's a fair enough attempt. Thanks, Andrea. And if you want more information about that, please feel free to contact MS Connect, and they should be able to help you with any questions you have.
Absolutely.
Sarah's written in to say thanks, a good reminder of things and what to do to prevent falls. She says that she has already slowed down, and she'll try not to rush, but will be decluttering as well.
Fantastic. So I'm just going to interrupt you there, Annie. There are many reasons to call MS Connect, and following up anything that you hear in a webinar or a podcast or a program that we run is a good reason to ring. And then there are some other webinar recordings that you might find assistive for this whole process. So if you didn't catch on to Preventing Falls Part 1, check out that. But we have a webinar program on decluttering, so you might want to check that out. We've also got one about the bladder changes. So if it is that you're rushing because of your need to get to the toilet, a sense of urgency to get to the bathroom, that you might want to find out a bit more about that, as well as going and getting assessed. And then we have a program on balance, and we have one on managing spasticity as well. So there's more learning you can do along the way as well. Thanks, Annie. Will I keep going on these and then come back to questions?
Yes, that's probably a good idea. Thanks, Andrea.
So we'll give you a bit of space if you want to type anything else in, but also just to let you know about a couple of other services that are worthwhile knowing about. On our website, we've got a Get Your Act Together tool. Now, this was developed for the ACT. That's why it's called Get Your Act, ACT, Together. But it's appropriate for anyone, no matter where you're dialing in from. It's an online tool that gives you some tips and tricks for managing your symptoms. So you plug in, you answer a few questions, and it generates some responses for you. Now, the only thing that won't be relevant if you're living outside of Canberra will be the services that it lists. But all the strategies and the tips will be relevant for you no matter where you are. We also strongly encourage people to get involved with our MS Employment Support Service if you're employed, because there's some great government assistance and as well as the support from our ESS consultants that can really help keep you working and make the whole experience of being at work and living with MS manageable. We also encourage you to check out the services and support available through the NDIS if you're under 65, and we are a provider, so MS can give you lots of advice and information about navigating the NDIS, and the same would be true of My Aged Care if you're over 65. So it's great to tap into supports and services. If recordings aren't your thing of the webinars, you can tap into our podcasts. I think we're up to about 18 of those now, Annie, aren't we? And then
yes, I think we've got 18 online now, so that's great.
Yeah, there's lots of information to just to be informed and to be proactive on, you know, things that would be helpful to you.
Yes, absolutely. That's great. Thanks, Andrea. Elizabeth has written in to say that this has been really helpful for her. So that's great, Elizabeth. Good to hear. Gail has said that she didn't realise that she had dropped foot. She's saying that knowledge is power, and that is such a true comment.
Sure.
She sees a physio regularly, and they've been working on strength and balance exercises. And she's saying thanks so much. So you're very welcome, Gail. Betty's written in to say that she's going to see an exercise physiologist, which is great. But she still worries about getting up off the floor, as she has one kneecap, so can't put weight on that knee. So she's asking, do you have any suggestions, Andrea?
Well, what comes to mind first is to talk to your exercise physiologist and get them to help come up with a way of you managing that and practicing it with them so that you feel confident to do it at home. Yep,
that's a great idea. Just scanning through. I don't think any more questions have come through. Anne is just saying thanks very much. That's been really helpful.
Great. So that's great. Thank you.
If there's no further questions, we might close for now. But a reminder that MS Connect is available. If you think of something after the webinar, please feel free to give us a call on that number. It's 1800 042 138, or you can send an email through. All right. Well, thank you, Andrea. That was certainly a lot of good practical advice and, you know, very helpful even for me. Thank you.
Right.
And thank you, everyone, for joining us for today's webinar. Hope you found it useful, and we hope to see you at the next webinar. Do take care, and if you wouldn't mind staying on to do our survey, that would be very much appreciated. All right. Bye for now.
Bye-bye. Thanks, Annie.